The Omicron variant spreads across the world. Scientists are now rewriting their expectations for the pandemic next year. In the United Kingdom, for one, the new variant is now on course to become the most dominant one. Cases in Britain are at an all-time high as of now. It comes at a time when the UK is gearing up for the festive season. Here are some numbers to show you how unprecedented the surge is as of now. Last year, in the week before Christmas, the UK was recording an average of 22,000 cases. However, this year, the 7-day average is almost 63,000, which is nearly a triple of the numbers that were seen last year. On Thursday, the UK set another grim record, reporting more than 88,000 new cases. Now that is a 31.4% rise from last week. The number of confirmed Omicron cases also rose to more than 11,000 in London. 73.5% of all COVID cases are now expected to be that of the Omicron variant. In the latest, Wales has announced new COVID-19 restrictions which come into effect just after the Christmas period. It follows moves in England and Scotland to tackle the Omicron variant. This has left many Britons scrambling to make alternative Christmas plans. They are facing changing government COVID rules, even with France shutting down its border to the UK. Until now, the UK government has stopped short of formally limiting socialising, but citizens have been asked to practice caution. For now, booster shots remain the only solution. Britain is now pushing for citizens to receive booster jabs. Pregnant women have been added to the UK's priority list for a vaccine. Meanwhile, the G7 called the Omicron variant the biggest current threat to global public health. The G7 health ministers earlier held their final meeting hosted by Britain. The focus was on global access to diagnostics, genome sequencing, vaccines and therapeutics in a bid to combat its spread of the Omicron variant. For more details about the spread of the Omicron variant in the UK, joining us now is Chris Jones from London. Chris, thanks so much for joining us. My first question for you, after 2020, is the UK now staring at another Christmas which will be hampered by the pandemic with a record surge in COVID cases?
Well, to put it very bluntly, yes, it is looking at a dampened Christmas. We heard the figures then, almost 90,000 new coronavirus infections was reported. That was the last set of data that we got. Around 1,700 of those reported to be as a result of the Omicron variant. And because of those cases and the rising number, a lot of people are being really cautious at the moment around the UK. And that's really quite disastrous for parts of the economy, such as the hospitality industry. We've seen thousands of people cancel their Christmas parties, Christmas bookings across the hospitality sector, which is meant to be, this period's meant to be their most lucrative part of the year. So this kind of rise in cases has been disastrous for them, and they're asking the government for help with those issues. So there's a lot of nervousness around the rise in cases at the moment, and there's a lot of questions that have been still yet to be answered.
Right, absolutely. Now, those scientists are yet to make a concrete assessment of the severity of the Omicron variant, but now the chief medical officer has warned of a significant rise in hospitalizations related to this infection, especially after Christmas. So how are things on the ground as of now? Are people following restrictions? Are they wary of gathering during the holiday period?
Well, people, as I say, are being very cautious at the moment. Many people have, like I've said, cancelled their social plans, which is kind of what Chief Medical Officer Chris Whitty had advised people to do. He asked people to put priorities or make sure that their priorities were in order so that the spread of the kind of Omicron variant and other variants, of course, don't go past a certain level. On Tuesday, we saw that Plan B came into action across England. That meant increased mask wearing, but also a message to people to work from home where possible. Only a few hours ago, we also heard from Mark Drayford. He's the First Minister of Wales, and he has put in place measures from the 27th, so just after Christmas. That will mean that nightclubs could close with those restrictions. And he's also put in place social distancing in places like shops and officers. That's a measure we've not seen for quite a while. And in Scotland as well, Nicola Sturgeon, the leader of the SNP, she's said that the Omicron variant has now become the dominant strain of the coronavirus. So there are restrictions that are coming in place, and at the moment people are really kind of sticking to them and enacting caution. But as I said, more restrictions likely to be inbound, and people are quite nervous about that.
Right, absolutely. Chris, my final question for you. The G7 recently termed the Omicron variant as the biggest threat to global health, currently with no concrete assessment whatsoever about the Omicron's true severity when it comes to symptoms. Do these remarks prove to be counterproductive? And we've seen this in the form of protests, anti-vaccination protests, especially in parts of Europe.
Well, it's really a tricky one to kind of assess. I don't think counterproductive is quite the correct phrase to use in this kind of instance. I think the G7 is correct in addressing the seriousness of the Omicron variant. If we just look at the UK, 90,000 cases, an unprecedented number, is the last kind of set of data that we've got. And just to quote the G7, they've said that it's important more than ever to cooperate and monitor as well as share data. This will be key in addressing the fast developing situation. And a fast developing situation it certainly is. However, you're right in the sense that we don't have all of the data as to kind of how serious this Omicron variant is just yet. And I think we're seeing some of those kind of opposition to that in certain parts of Europe, especially where mandatory vaccinations are being put in place. People aren't sure whether a jab will really make much of a difference. But governments across the world, especially the G7, are remaining cautious. And the last thing here in the UK the government will want is to see the National Health Service put under pressure just like it was all those months ago. So a lot of questions still to be asked and a kind of a lot of cautiousness from the UK at the moment.
Absolutely. Chris Jones, thank you so much for all those inputs, and thank you for joining us from London on this story. Now, staying with this story, and for a better understanding of what's happening with respect to the Omicron variant in the UK, we're now being joined by noted virologist Dr Sarah Pitt, who joins us now from Brighton in the UK. Welcome to WION, Dr Pitt. My first question for you. The UK's 7-day case average in December 2020 was close to 22,000 cases a day, which for the same period is now close to 62,000 cases a day. So what are your observations on this?
We have been running at between 30 and 40,000 new cases a day since the summer, so since sort of June and July, the UK summer. And since in the September, October, schools and universities all go back. And so there's more mixing of people in enclosed spaces, and the numbers have continued to rise. And then it's only in the last 2 or 3 weeks that they've suddenly shot up. Yesterday it was reported at 88,000 new cases a day. And because of the way that people are not everyone's not necessarily testing themselves all the time, we think it might be more than that.
Absolutely. Now, at more than 90% vaccination coverage, the UK surge has resulted now in a push for booster shots, which is what the UK Prime Minister has been pushing for. So how do you think that these booster jabs will help in tackling the new Omicron variant?
What we know about Omicron is that the virus has changed in a number of places. So in the spike protein, which is the sticky out bit that you see in all the pictures of the virus that attaches to your cells and helps that virus to get inside your cells and cause the disease, there are some very important changes to the code of that and to what that looks like, compared with, say, the Delta variant. And it's a bit similar to what we saw with the Beta and the Gamma variants from early on in 2021. Your listeners may well remember those. And we were worried about those because we thought that the vaccines wouldn't work quite as well against them. And that turned out to be the case, but Beta and Gamma didn't really take off. Unfortunately, as your listeners know only far too well, Delta came along. and just moved everything out of the way and caused terrible devastation. And it's just heartbreaking, isn't it? It's just awful. So what we're slightly worried about with Omicron is because it's got those features with the Delta and the Gamma variant, the vaccine may not work quite as well against it. But what we have found in laboratory studies at the University of Southampton in the UK, and probably other labs as well, but I know about the UK one, they already tested the option of doing a booster against the Beta and the Gamma variants, and they reported that about 3 weeks ago. And that showed a really good protection, about 75% protection against Beta and Gamma. And so that's what we think, that the boosters will give us that extra 60-70% protection against Omicron, just because it's very similar to the Beta and the Gamma, and we know the booster option works for Beta and Gamma, so that's why we're trying it.
Right, Dr. Pitt, my final question for you. With this new variant, the term mutation has now been used much more than any previous variants. For a common person, that is the significance of these higher number of mutations. And what is the significance for the common person when it comes to this specific Omicron variant?
So the mutation just means a change in the code of the virus. So the virus genetic code is sort of a recipe to make all the bits of the virus, if you like. And there's a slight change in the recipe, which means what the virus looks like when it gets inside your body is a little bit of a different shape. That's what we're really talking about here. And so the previous variants only had 1 or 2 changes in that recipe, so that this shape was slightly different, but not quite as much. Whereas now, because this one probably 50 or 60 different changes compared to the original Wuhan strain that we saw in China, that means the changes in the shape are in some quite important places on the virus, particularly, as I mentioned before, there's the spike protein, which you see in all the pictures. But you can see, if you think about the pictures, it's quite a complicated shape, and you could see how a little bit of a change in that shape would alter the way the virus can behave inside you. So that's really what it's about. And your listeners shouldn't be too worried by the term mutation. It's a bit of a scientific jargon thing, and it just means change and changing the recipe.
Right, Dr. Pitt, thank you so much for all those insights, and thank you for joining us on WION World is One at this hour. WION World is One is now available in your country. Download the app now and get all the news updates on the move.